Fellowship, which is our social science research center for the College of Arts, Humanities, and Social Sciences at UMBC. So thank you all so much for joining us. I'm going to turn it over to Maggie Holland to introduce herself and give you an overview of the panel and panelists today. Thank you so much.
Great. Thank you, Christine. Thanks, CS3, for hosting us. And thank you, everybody, for coming. Yes, my name is Maggie Holland. I'm a professor in the Department of Geography and Environmental Systems. And just to give you a really quick genesis behind this particular panel event, Christine and I were trying to think of a way for CS3 to start to feature more about geospatial data and geospatial analysis as it pertains to social sciences. And we thought a particularly good place to start would be thinking about the work that people are doing in Baltimore City and different organizations that are working on geospatial analysis and providing data access to research and work in Baltimore. And so as part of my Applied GIS course this semester, we have been looking at this a lot in terms of our own lab and project work. And so I invited one of our graduate students, Brian Horlick-Cruz, to help me facilitate this session. And we've invited two practitioners from Baltimore City organizations, institutes, to share with us about their work today. And I will now hand it off to Brian to introduce our practitioners.
All right, thanks, Maggie. So very pleased today to welcome Jami Harding and Chery Knott, who are two pretty experienced GIS professionals who've been working in Baltimore with geospatial data for over 10 years at this point. So Jami Harding is here from the Johns Hopkins Center for a Livable Future, and Chery Knott is here from the Baltimore Neighborhood Indicators Alliance, which is part of the University of Baltimore. And so, yeah, we'll take maybe 15, 20 minutes to hear from each of them, presenting a little bit on their backgrounds, on the kind of work they do. And after that, we'll open up the panel to questions from the audience. So in the meantime, if we could please hold questions till after our speakers have finished, we can put them in the chat or anything like that, and we'll get to them afterwards. And also, it's worth noting that Chery Knott is a GES alumna from here at UMBC. So yeah, it's good to have you back here, Cheryl. And very cool to see an alumna out here presenting. So without further ado, Jami or Cheryl, would either of you prefer to begin?
I'll just say, unfortunately, my video stopped working. I apologize. Just as the session got started, it just stopped working and I can't seem to get it back up again. Should I continue or try and log back in?
How about we go with Cheryl first, and then in the meantime, if you could try to log back in or reboot or whatever you need, we'll see if that works.
Thank you.
Yeah, sure. So yeah, Cheryl, would you like to get us started here?
Sure, absolutely. Let me get my screen share going. So bear with me, folks, for a second. All right. Well, I am very pleased to be joining in and being a part of this panel presentation. So as mentioned, I'm with the Baltimore Neighborhood Indicators Alliance. I've been with this organization since 2007. 2007 is also when I graduated from UMBC with a Bachelor of Arts in Geography and Environmental Systems and a certification in cartography. I do also want to mention I returned to UMBC, so I have a couple of degrees from there as well. And so I'm happy to talk a little bit about my background academically at UMBC, just kind of mention how I got started onto my particular career, and then a bit about the Baltimore Neighborhood Indicators Alliance, and then highlight a few of our open data sets that are incredibly useful if you're a researcher, either as a student or faculty, staff researcher, if you're a resident of the city of Baltimore and you're curious, also if you're a community organization or an activist. So hopefully this will be a lot of good information that is going to be usable. So I graduated in 2007, May 2007, with that GES degree. I also studied cartography. So I don't believe that the GES department still has the distinct GIS and a distinct cartography certificate, but I ended up taking that more graphic design approach and took a lot of classes around cartography itself. I only took 2 GIS classes, and so that's kind of a fun thing that I've been a GIS professional for many years now, but I really never would have described myself as a GIS professional or wanting to get necessarily into that GIS profession. Certainly with a strong background in urban geography, social geography, and seeing map making and the cool ways that you can ask questions and answer questions with maps through just these graphic visualizations and these presentations. That's totally what I was about. And so I returned to UMBC, and while I was working full-time, completed a Master of Arts degree in Applied Sociology, and I graduated in the spring of 2013. So 2 very, very different programs. One is a full-time undergraduate student getting the degree and the certificate. Second time around, full-time worker. I tried the full-time student thing. That was a little bit crazy. And I actually did start off in the master's program in GES, and I had taken a couple sociology classes as electives when I was working on a master's degree in geography, and I really fell in love with the discipline. So I'd never really taken sociology classes, well, many sociology classes in undergrad, and I saw it as a really interesting way. I spent 4 years of that undergraduate career very much thinking about where and why, and the sociology component allowed me to start answering questions of how, and also part of that why. And so I really enjoyed the time that I had at UMBC. I mean, there was obviously a reason why I came back to get a master's degree as well. And so I just really love these opportunities to think about people and where they are and what are they doing, the structure of cities, and of course the map making skill sets and tools to answer these questions. So I started working for the Baltimore Neighborhood Indicators Alliance back in 2007, literally, I think, 5 or 6 days after graduating from UMBC. And my first position with the organization was as a GIS and data assistant. 9 months later, I became a GIS analyst. I served in that role for about 10 years for the organization. 2017, I became a GIS project manager. So we're a very small organization based at the University of Baltimore within the Jacob Frantz Institute. And I believe about half of our staff are on this call today. So myself, and then also Carlos Carpati, who is our data wrangler and developer. He is also a graduate of UMBC, although not the GES department, but we don't hold that against him. So our organization was founded on this idea of making data open and accessible to anyone who is interested in learning about Baltimore's neighborhoods. So about 20 years ago, a group of stakeholders came together. And so these were folks from city agencies, state agencies as well, researchers at universities. We had community development corporations, we had community organizations and funders who wanted to put together a way to get data from a lot of different city agencies into one place, to be a one-stop shop of data. Because if you were a resident or if you were a researcher and you wanted to know about a community, you would have to, back in 2000, maybe send an email, pick up a phone, fax over a request for information, and hope that somebody got back to you in a timely fashion. So it was this idea of being able to pull together this data so that our organization could do the hard work of calling, harassing the wonderful people at different city agencies to say, please, 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 we want some data. And so we've been doing that for a long time. And that's allowed us to build up a spatial data repository where we have, in many cases, for many of our statistics, about 20 years worth of data. And so this allows us to do longitudinal data analyses, allows us to do spatial analyses. So we look at neighborhoods and communities within Baltimore City to look at the different trends that are happening. And so our organization is majority grant funded, but we also take contract work. So we are gratefully supported by the A&E Casey Foundation, who allows us to do a lot of this open data work, which I'll talk about in a second. But we also love partnering with different researchers, partnering with foundations to do research and to help provide contextual information about Baltimore's neighborhoods. So our biggest product and the thing that we're most well known for is a report and a data set called Vital Signs. So you can think of it as like every year when you go to the doctor for your physical, the doctor takes a lot of different data points about you. So your weight, your blood pressure, your temperature. If you have blood work done, they have all sorts of information on your blood panel. And so all of these bits and pieces of information, they're not 100% you, but these are statistics that are representative of you and your health. And when you start tracking these things over time, you can see, okay, your blood pressure is going up, so you might need an intervention, or your weight is going down, great work. And so you can think of our data sets as these vital signs, these health indicators for neighborhoods. So we look at things such as census demographics. So who are the people living in neighborhoods? Thinking of age breakouts, race and ethnicity, thinking about socioeconomic characteristics. We look at housing and community development data. So thinking about housing markets, where are vacant properties in a community? Where are the homes that are being sold? We look at children and family health and well-being. So thinking about life expectancy, childhood lead exposure. We think about access to healthy food, and that will transition a little bit to Jami's presentation in a little bit, because the Center for Livable Future is one of our data partners. We look at crime and safety, so where are violent crimes happening in the city, property crimes, 911 calls. Workforce and economic development, so thinking about where are businesses, where are jobs in the city. Arts and culture, this is something that we started looking at in 2011. This allows us to think about creative placemaking and ways and opportunities that residents can get involved in expression and culture in their communities. Education and youth. So we have a partnership with the Baltimore City school system that allows us to look at things like student attendance and enrollment. We look at test performance and a few other measures. And then lastly, sustainability, which is a really large catch-all category that allows us to think about things from transportation and commute statistics. We look at things around weatherization. We look at electric versus gas utilization for heating in homes. We look at voter participation. So we look at in all over 130 different statistics. So these are counts, rates, and percentages for 55 of the communities in Baltimore City. And so we pull this data from about 50 different sources. We release it every year. This year we released data through 2018 through our open data portal. And so the idea is that all this data is like accessible, it's actionable, and you can use it. So we serve so many different folks with our data. So we try to make it available in a lot of different formats. So we offer tabular data. So if you're interested in doing some stats, you can pull down a CSV file, import that in to SPSS or SAS, do some work in Excel to create your own visualizations. We also offer GIS data formats. So if you're interested in making maps of some of our community data sets, you can download a geodatabase, you can download some GeoJSON files. If you're a developer and you would love to plug our data sets into a website or a map, we have APIs that are hosted through Esri and the ArcGIS online platform. We also provide narratives about our data sets. So as I was describing those categories of data, we provide about 8 write-ups every year that kind of talk about the trends. So if you're not necessarily a numbers person, you can still read the report and think about some of the things that might be going on, trends that you can see in this data. And then lastly, map images. So we have on our website downloadable JPEG maps. So if you're, again, a student, if you're a researcher, you like some of the pre-made maps that we have, you can download those, stick them into reports, stick them into presentations, and use them. So from all of our work, and we've been looking, as I said, at a lot of these different data sets, statistics for upwards of 20 years, we have just a lot of data and information that is kind of readily available. It's already kind of packaged up and ready to go. And so we were thankfully in a good position when the coronavirus started impacting our day-to-day lives. And so when the stay-at-home order was issued back in March, there were a lot of questions that came to us about, well, what are vulnerable neighborhoods? What does the case counts look like? And just thinking of ways that we could harness data sets that we have already into different dashboards and tools that allow people to answer questions that they might have. So the first thing we actually did was we worked with some partner researchers at organizations across the country through the National Neighborhood Indicators Partnership. It's a group that we're a part of. We were able to calculate a infographic, and we produced this that tries to approximate the number of lives saved through stay-at-home orders. So when people are at home, not out interacting, not out in public. And then that led to this big map, which I have a screen cap of that on here. So we pulled in a lot of our community indicators from our vital signs report, and we overlaid that with the API from the State Health Department to visualize locations of case counts by zip code. And so we've been able to pull in a few different data sets to visualize there. And then we've also been looking at things like the case counts and how it relates to different customer service requests. So like if somebody calls 211 United Way for help, 311 if there's a nuisance in the neighborhood, 911 to report a police emergency, we wanted to see what people were calling for assistance with. And then also we had seen some research from the Baltimore Sun, some reports that are kind of talking about the differences in crime rates. And so that led us to dig in, and we ended up putting together a dashboard that talks about the differences, looking at it from different quarters of the year, comparing 2020 to 2019 to see that, hey, in regards to some different types of crimes, there are definite huge decreases, from the stay-at-home orders, but then there are other different types of crimes that are on their way up. So these are just some tools to help folks think about data and really be a starting point to digging in, asking questions, and answering some questions as well. So I just wanted to drop in some contact information here. And if there is a moment or two, I could go onto the website and just show really quickly the ease in which you can access these tools. They're entirely hosted on ArcGIS Online, and the goal is to make this information open, available, usable, actionable, and just relevant for everyone's daily life. So
I would say there's time, Cheryl, and please go ahead. Yeah.
Yeah. So here is our webpage. So our website is at BNIA. jfi.org. So again, our organization, we just refer to ourselves as BNIA, so Baltimore Neighborhood Indicators Alliance, and then the JFI at the Jacob France Institute at the University of Baltimore. So on our main page, we do have a pipe into our most recent edition of the Vital Signs. So on our website here, it allows you to take a look at data by community. And so we worked with those stakeholders about 20 years ago to come up with these 55 community statistical areas in Baltimore. These, by the way, these are aggregations, these are clusters of similar census tracts. So we've got 55 of these in Baltimore, derived from about 200 of these census units, the census tracts. So if you're already kind of familiar with Baltimore and you have a definite sense, oh, I definitely live in the Bella Edison community, you can hover over the map, click on it, and then dig into data for that community. If you're less familiar, we have this base map for reference here where you can zoom in, zoom out, take a look at the streets, and then click on the map. Or we also have a button that allows you to input your address and it will zoom into a location, and then you can access this data and information. So we also offer data by, sorry, I have to move move people's heads around. We offer this data by the topic area. So if you're really interested in data for all of the communities, not just the one around one of these subjects, you can go in here, click on this button up here, and it'll give you the topic areas, and then you can go through. Or if you really have a sense of what you're looking for, you can do a keyword search that will allow you to pull up a data set that you might be looking for. So really quickly, if I do the community, I just want to show, I've been picking on Bella Edison today, not sure why. So if you click on it, it'll zoom into the map, and then there's this button here on the other side that says view more data about this community. So I'm going to click on that, and it will take you to a landing page with all of the data that you have for the Bella Edison or another community. And then you can just click on these 8 different topic headers to view data, and we have the most recent data available for these different statistics. And if you're uncertain about what these data sets mean, you can just hover over it and it'll give you a definition. So let's say though you're scrolling through here and you see, okay, median price of homes sold in Bella Edison was about $80,000. So is $80,000 good for Baltimore? Is it bad for Baltimore? If you click on any of these indicators, it will take you to the landing page for that statistic. And so we provide the source of it, the years of data that we have available, a definition, and then this allows you to see Baltimore City values, the different community values. You can sort this data. You can download it right here if you'd like. You can save it as a PDF. But then we also offer different charts, which are sortable based on the name of the community or values. And then we also have trends. So you can build your own line charts. And so on our website, even though we've been doing this for 20 years, you can look at data for the past few years, so 2010 onward, and select different communities. And then you can visualize these values relative to Baltimore City. And so that's just and then we have our indicator maps. So these are pretty straightforward choropleth maps that allow you to visualize this data spatially. So light colors are representative of low values, dark colors, higher values. So we also have our open data portal. And I'm just going to click to go back to our main page. So we have this open data portal, and this is the place where you can hop over to ArcGIS Online and be able to start downloading data, accessing APIs, and that sort of thing. So I'm just going to click over to the VitalSense Open Data Portal, and this, again, very similarly, this allows you to access some of these indicators. You can just do keyword searches. You can explore by topic area, and then we have narratives. So we use the ArcGIS Online Story Map platform for putting in these narratives, and we have some other visualizations and that sort of stuff. And then lastly, I'm going to hop back over to this open data portal to go to our coronavirus page where you can see those visualizations. So this will open up right here. So initially we were just looking at Baltimore City, but we recently expanded some of our data sets that are coming from the census and the American Community Survey, so some of these demographics, to visualize Baltimore County as well. And so we are constantly pulling in data from the health department. So every day at 10 a.m. they publish new data sets. So these proportional dots, these are representative of the case counts from the state health department. So we pull that in, and then we have different indicators that kind of describe what's going on in the city. So some of this data is zip code level, some of it is like a census, like the community statistical area. We look at what are called regional planning districts for the county. And so we have things around digital access, pandemic unemployment claims. We look at households that might be economically or housing insecure. And we also think about folks that might be using public transportation to get to work, thinking about students who might be learning from home. And we also include a measure around digital connectivity. So how many people in a community have access to the internet at home, like on a non-cell phone device. And so all these tools have been really helpful for folks in doing advocacy for, transportation, advocacy for, improved digital access. And the hope is that all of this data can continue to be a useful resource for folks as they're thinking about what's going on in neighborhoods. So I'm pretty much going to stop there, and I guess if we have any questions now or if we're saving to the very end. But again, I just hope that we can be a resource. I'm a UMBC graduate, so always excited to bring some of these resources that I'm working on at the University of Baltimore back to students and faculty researchers here at UMBC. So thank you for having me. Okay, saving questions for the end. Okay, thanks, Maggie.
Thank you so much, Cheryl. That was really, really great. Great to hear. So now we'll hear from Jami Harding. Are you ready to go ahead and load up your presentation?
Yeah, thank you all for your patience. It seems like my video is actually sharing now. I'll try and share my screen here. Can everybody see that?
Yep, this looks great.
Wonderful. All right. So let me just start out by saying thank you for the invitation to speak here today. It's wonderful to be able to share some of our work at the Center for a Livable Future. And it's wonderful to share the stage a little bit here with Cheryl Knott, who we worked with in the past and does, as you saw, amazing work for BNIA. And I'm excited to talk about data, especially Baltimore City data here today. My name is Jami Harding, and I'm a GIS specialist at the Center for a Livable Future, which is at Johns Hopkins University. As Cheryl did, I'll start off with a little bit of a background about myself. I actually started working in GIS about 20 years ago as a student intern for the United States Geological Survey in Reston, Virginia, and I was mapping coal outcroppings in Ohio and Pennsylvania. GIS back then looked very differently than it does now. Everything was command line, and I used something called ArcInfo, which I don't believe exists anymore. That job enabled me to get another student internship while I was doing my master's at Michigan State University. And I worked at a research institute that was analyzing deforestation rates in Southeast Asia and Brazil. That GIS experience that I learned at those first two positions enabled me to get a job working at a hydrology consulting firm in Tucson, Arizona, which is where I moved after my master's work. And when I moved to Baltimore City, I was able to use my GIS skills to get a job working for the Baltimore City Department of Transportation. And most recently, I was able to secure a position with the Center for a Livable Future at Johns Hopkins University. So as you can see, GIS has enabled me to work on a number of different projects all across the country, and I feel very lucky that it's sort of been a foot in the door for me. And it's enabled me to work on all sorts of very cool projects and very interesting projects. The Center for a Livable Future, if you guys are unfamiliar with it, is an academic research center based at the Bloomberg School of Public Health that's focused on the intersection of public health, the environment, and the food system. And within the center, we have four major program areas. The first one is policy and public health, and that mainly focuses on food policy at the state and federal level. We also have a program area on food production and public health. And that, I think historically, has worked a lot in the antibiotic resistance world, but as I'll explain a little bit later, has also been very involved in some urban agricultural research as well. I am based within the Food Communities and Public Health program, and that program is more focused on local level food policy. So we actually have an organization or a group within that program area called Food Policy Networks that works with food policy councils all across the United States and Canada, which I think today there's roughly about 300 different food policy councils in those two countries. And then the fourth major program area is food system sustainability and public health, and that group largely looks at food waste and food resiliency. We also have an education program, and we have a program as well on seafood, for the study of seafood. So one of the major projects that I've worked on over the years for the Center for a Livable Future is something called the Maryland Food System Map. Maybe some of you have seen this, maybe not. But we launched it originally in 2012, starting with 30 different data layers, sort of spanning the food supply chain from ag production to consumption. And over the years, we've grown the Maryland Food System map. We actually have over 170 different data layers on the map now. And as you can see over here in the menu, we have anything from demographics to environmental indicators, information on nutrition assistance, all sort of to fill out the big picture of the food system across the state of Maryland. And similar to what Cheryl was saying, we've created this as a one-stop shop. So instead of having people go out to different state agencies or maybe even federal agencies to collect information on the food system in Maryland, we've tried to curate that data ourselves and put them up here in one location for people to access. This past spring, we added a new category of information. As you can see, it's food information related to COVID-19. I'll just click on one of the sites here. This is data that we are pulling from the Maryland Food Bank, showing food distribution sites. As I mentioned earlier, we have typically curated data, which means we have collected it, whether it be as a Excel spreadsheet or as a shapefile or some other format. But because of the nature of the pandemic, we wanted to have as up-to-date information as possible. So we actually reached out to different agencies and asked them if we could use their map services as a part of our map application. And so you can see we show the current sites for the Maryland Food Bank. We also collected information from I'm trying to think of the name right now, it's just drawing a blank. Anyway, we have projected food and security rates across the state by county. If you were to zoom into Baltimore, we could take a look at something a little bit more fine-grained. For instance, let's say we wanted to take a look at the percent of population 65 years or older by census tract to see where the vulnerable populations for the city are, where you may want to locate different food distribution sites for those people that are unable to get around to supermarkets or other markets as easily as other people. And I'll just turn these off, and I'll say that we have a portal as well, open data portal as well. I'm showing here is farmers markets in and around Baltimore City. So you can see if you click on this information button, you have an ability to go to our open data portal. I've actually pulled this up separately so you can get a chance to take a look at it in the screen. And I've actually selected farmers markets. So you can see that we have data for 2020, and most of the data that we have up on our food system map is current data, but within the open data portal, we have data from prior years. So for instance, 2017, 2018, 2019, 2020. So you can take a look at the change in data over time. And if I were to click onto this, you can see that similar to what Cheryl showed, you can download the data as a spreadsheet, a KML, or as a shapefile. So the other major project that we've worked on over the past number of years is mapping the Baltimore City food environment. And that's a project that we've collaborated with the Office of Sustainability at Baltimore City. And some of you may be familiar with this work, some not. What I'm showing here is the 2018 report that we published. And within this image, you can see at the center, the Healthy Food Priority Areas map. Many of you may be familiar with food deserts. In 2018, we decided to change the name to Healthy Food Priority Areas. One of the reasons why that was changed is that the population in Baltimore City didn't relate to the term food desert, didn't really feel like it was appropriate. And then also, as I'll describe here in a second, a lot of the analysis that we did was really taking a look at healthy foods and the healthy food availability in Baltimore City. So here's the definition for what a healthy food priority area is. You can see that it includes the distance to supermarket is more than a quarter mile. Median household income is at or below 185% federal poverty level. Vehicle availability is more than 30% of households have no vehicle available. And then the last variable that we used in our analysis was something called the Healthy Food Availability Index score, and I'll explain what that is in a moment. It was a unique data set that in 2012, when we created our first map, we had some information from a researcher that had come over from Madrid that had collected information by going into food stores, assessing healthy food availabilities within those food stores, and we were able to use that for our 2012 map. In the summer of 2012, after we released that map, we actually went out and did a global survey of all food stores within Baltimore City, and that is over 1,000 food stores. And just so you have an idea of what type of items that we were looking for and what actually went into the index, here's a screen of the different scored items. And then you can see in this screen too, just some images of the different types of food stores that we went to. That includes supermarkets, small grocery stores and corner stores, convenience stores, and then lastly, we also use the food markets, the public food markets too. So this is an example of one of the surveys that the interns that we had used to assess food system or healthy food availability. One of the interesting things in the spring that we discovered, as I think all of us discovered, was that able to keep up with a rapidly changing situation with the pandemic, we couldn't use a similar analysis for analyzing the food environment in Baltimore City. So the city decided to change course and use a SNAP data that they obtained from the state and show where concentrations of people were that were using SNAP, which is the Supplemental Nutrition Assistance Program. And as you can see on this map, they have the percentage of population receiving SNAP benefits by neighborhood, which is a really remarkable thing that they were able to collect that or work out an agreement, I'll say, with the state to obtain that information. The state in the past has not been willing to share that information as willingly. And then you can see overlaid on top of that SNAP information, they have the locations of where they're have put produce boxes, grocery boxes, mixed boxes, meals that are going to older adults, and then of course food pantries as well. So this is actually, if you can see down here, was something that was released in November 2020, maybe like a week or two ago. And it's really a great way for people to have an idea of what's going on within the city as far as the food environment goes, especially during a pandemic or the pandemic. And just briefly, I wanted to say that in addition to those two projects, we have worked with a lot of different stakeholder groups, different nonprofits, advocacy groups in and around Baltimore City. And we have also collected our own information related to urban agriculture in Baltimore City. I'm showing just the website of the Safe Urban Harvest Study, which is completed maybe 2 years ago. I should say my colleagues went out and worked with urban farms and community gardens. I think there's roughly over 100 of those urban farms and community gardens in Baltimore City. And they collected samples of soil, water, and produce and tested them for heavy metals just to get an assessment of what the risk is associated with urban agriculture. A kind of connected project, this actually came before Safe Urban Harvest. We connected with people that were doing foraging in and around Baltimore City. And we're able to interview them, ask them where they were foraging for food, and this could be, say, berries or fruit or greens, and then or mushrooms, and then so where were they foraging? What were they foraging? How much were they foraging? And the idea was to assess what knowledge that they had about the risk associated with the locations where they were doing their foraging. And then lastly, I'll say happy Geography Awareness Week to everybody. GIS Day was on Wednesday, and for the past 3 days, we've been hosting webinars. As you can see, we had 2 each day. We were co-sponsoring with the Spatial Science for Public Health Center at the Johns Hopkins University. And we hosted 2 food-related webinars, as you can see, the very first one and the very last one. And then we had a whole host of other different discussions, all very excellent, all related to GIS. And I'll recommend that if you're interested in learning more about the dashboard that JHU has developed, you can take a look at the very first session that was on, I guess it was yesterday at 12 p.m. And anybody who's interested in Health GIS should definitely check out the keynote that we had from Esther Garrity, who's the Chief Medical Officer for Esri. And at the very bottom of the slide, you'll see the website for the landing page for our event. And we are hopefully going to be posting recordings for each of these different sessions up later today. So if you're interested, definitely go and check that out. And I'll end there and say thank you again, and look forward to answering any questions.
Wow, thank you, both of you. This has been incredibly valuable to learn about all the work that you're doing. Actually, I'll hand over to Brian, but I just wanted to comment that I'm seeing lots of comments to me or elsewhere in the chat, and so I know there are some questions from the group. But Brian, go ahead and you can facilitate that, and I will also monitor the chat. So if people have questions, I'll chime in to pose them if they don't want to pose them themselves.
Sure. So yeah, I guess that being said, thanks again, Cheryl and Jami, for your very fascinating presentations. And yeah, at this point, if anyone has any questions, you can feel free to unmute and share them now, put them in the chat, or I can go ahead and post some. Okay. Well,
Andrea has a
sorry.
question.
Yes, Andrea.
Thank you. I have been all week listening to, as someone who studies public health ethics, vaccine distribution plans, and some of the challenges that are anticipated around misinformation, myths around the vaccine. I'm wondering if any of your data collection mechanisms, either Cheryl, Jami, anybody else who knows about how, this is all new to me, except that I use the maps in my teaching. But I'm wondering if there is any data out there on things like the distribution within Baltimore around trusting government, or places where we could start to try and find out where there's going to be resistance to vaccine within the city.
Mm-hmm. So that's an interesting question, because I was just yesterday thinking about different ways of measuring civic participation. So thinking about what are ways for residents, for community members to kind of, interact with the city. And so there's a few different ways of kind of capturing how residents engage. And so that's assuming you want to use like engagement as a proxy for trust. Because a lot of times, like trust of government, trust of agencies, it's really difficult to get unless you're administering a survey. But so you can certainly take a look at things like voter participation rates to see how, well, first off, like how many people are even registered in a community to vote, and then how many of those that are registered do vote, or conversely look at the voting rate compared to the total adult population. So that kind of gets a sense of how frequently people are going out to participate in that civic process. But then also you can start to think about the 311 and then the 911 call data sets, because those data sets are very interesting because they can be used as both a measure of things going on in a neighborhood. So obviously you're not going to have a 911 call for a shooting if there isn't a shooting in your neighborhood. You're not going to have a 311 call for a pothole or a broken streetlight. But these are ways of measuring what's going on the ground, but then also how willing are folks to call city services to report these things. So how willing are residents to call 911? Because it can really get at like the level of trust that residents might have in the police, that they would respond in an appropriate time frame and have an appropriate response, thinking, is it safe to call the police? In terms of the 311, thinking through if you have trust and belief that the city agencies, be it Department of Public Works or the Health Department, again, that they would come out in a timely fashion to address any needs that they have. And so I've been thinking through ways of, well, how can you actually analyze these data sets to figure out a way of measuring engagement through 311 or 911? Because there's certainly a difference between a neighborhood that just doesn't have anybody calling because they have no trust in agencies, a neighborhood that might have one report per issue, or a neighborhood that sees an issue in their neighborhood, sees a crime being committed, and then suddenly everyone's picking up their phone to call 911 or going onto the app to report it. And so thinking through ways that people engage with these different service requests, but then also thinking through potentially even one that pops up is hard to count areas for the census. So where are people that have been identified by even the Department of Planning as difficult to get a hold onto? So this might be folks that might not have digital access. So if they're receiving any marketing materials, they might not know what to do, how to engage, concerned that if there's somebody coming from an agency that they might have ulterior motives for it. So those are kind of ways of getting around that, but it would certainly be very interesting to see where there might be these deficiencies in communities because there's just breakdown in trust of who are you, why are you doing this, are you really asking me if this is what I want, when I want it, and how I want it. So it will be very interesting to see how that ends up panning out of, the actual deployment of the vaccine, if they're going to be taking different approaches for different types of communities.
I'll just add that, and this is really just sort of saying again what Cheryl has just said, that making sure that you have data available to people, make sure that you're open about the data that you're collecting and posting it so that they have access to it, and then making sure that you engage with different communities, whatever that engagement may be, is also a way to build trust in communities. And as far as the vaccine data goes, I would suggest that you take a look at the Baltimore City Department of Health. They collect all sorts of information, and they may actually even maintain information on communities that may not be vaccinating already. This is prior to the pandemic. And they may use that for their analysis and may use that for their strategic planning as far as how to get vaccines out to different populations.
Yeah, I was just wondering if any of you knew exactly whether anybody's thinking about and planning to do this work already, because there's so many large collaborative efforts going on in Baltimore with the Urban Health Institute and the Department of Health. And I would, this question is fascinating to me. And I'm a qualitative researcher, so I would want to go walk up and down the streets of Baltimore and ask questions. And I'm just wondering if it's already in the works and planned, or whether there might be an opportunity to get in and do some of the work. But thank you.
And I'll just say that the Maryland Emergency Management Agency is also a place to take a look at plans such as that you're talking about, how to distribute vaccinations. They've been really spearheading, at least for the state, the response to the pandemic, and I would assume that they would be connected to this kind of a response.
I have a question. Thanks. Thank you all so much. This is super fascinating. I actually had two questions for Cheryl about the BNIA project. So I think you had mentioned something about more cultural related projects at one point, something with schools. And I was curious if there are opportunities for researchers to get involved with those, something that might not be, open data sets. Just curious if that was a possibility. And then the second question was whether any of these projects are citizen science type projects, or if it's mostly researcher-led projects. I was just curious on that.
Mm-hmm. Sure. Well, in regards to that first question, we do have a really cool tool, and I'm going to put it in the chat. So a few years ago, we worked with a group of stakeholders who are really interested in mapping out the arts and cultural landscape in Baltimore. And so it was a project called Geoloo. So geoloo.org is the website. And so it was an initiative to pull together both the community indicators that we have. So thinking about, again, like demographics and socioeconomic things, but then also like youth, and then looking at things like locations of public art, locations of like publicly funded arts and murals, places of, like learning. So thinking about like libraries, recreational spaces, event spaces, all these different places for creative placemaking, and even like recipients of arts awards, to think about the spatial distributions of artists that are getting funding for their work. And so it was also this opportunity to look at existing data sets. So existing like administrative data sets, like official rosters, locations of things, known programs, and then take that to communities and say, okay, so this is what the official records are for your neighborhood of what's in here. Are there things missing from the map? And so it was an opportunity to then start crowdsourcing information about events, about places and spaces and people in the community that can be mapped out and be relevant for any types of creative placemaking. And there were a few different measures that we were looking at around arts education in schools, different youth programming, and working with a lot of those partners. And so it's been a really interesting process, again, of just like mapping out also some of these disparities, because if you take a look at the maps, you can sometimes see these very distinct spatial patterns that have been referred to as like the black butterfly, the white L, that are very heavily racially tied to what you're seeing going on, and to be able to advocate for these additional opportunities for community members to share out their own inventories and assets so that they have their representation. Because you frequently hear people talking about how there's so much disinvestment, there's lacks of opportunities, there's deserts, whether you're talking about like food deserts or play deserts, art deserts. But in many cases, these aren't deserts per se. It's just like we don't have that data on those places. And so we try to obviously use data sets from official like agencies, because that's such low-hanging fruit that we can get this data and information and we can kind of start getting a sense of what's happening on the ground. But being able to partner with community organizations, with activists to start bringing in their data is incredibly important. And so we have worked with a few different partners who are doing work on the ground of doing their own inventories of community assets, who are interested in advocacy at a very small level, and kind of talking about like I said, these official data sets, because there are so many decisions at the local and state and federal level about these communities. And if you don't have that local input or like that local perspective, and that they don't understand why funding might be going elsewhere or decisions for investments are going elsewhere, they don't know to advocate for those things in their neighborhoods. So we're always interested in working with a variety of different clients, be it, like the person in the neighborhood that, hosts the potlucks and, is always trying to get people active and engaged in neighborhoods, to the Department of Planning. We worked with them on a capital investment analysis. We've certainly worked with the state health department, the state DLLR. And so, in addition to that, we've worked with different foundations locally. So we try to just, help anybody who has this question about what's going on in my neighborhood. But we are very intentional that any project that we do is going to be in the best interest of residents and really work towards advocacy and improving quality of life.
Thank you so much.
We probably have time for one more question, if anyone has something burning.
I love the question in the chat about the murals. We, when our students went out to survey different food stores, it was one of the photos that they would bring back to us each day were the photos of murals. They loved them. So it's wonderful to know that there's a Baltimore mural map.
Mm-hmm. Yeah, it's interesting because we started thinking about murals and art in terms of what are some easy data sets. And so we had partnered with the Baltimore Office of Promotion in the Arts to get out their inventory of publicly funded art. So that was an opportunity to get this data set, and we know now where some of these locations are. But again, that's missing things, projects that aren't publicly funded. So knowing that there's other organizations doing this work, that's just incredibly another important piece of the puzzle to pull in.
And I think overall this conversation and what Cheryl and Jami have presented today, for those of you that are newer to sort of mapping communities, these are all of the practitioners and those in the world, think very flexibly and openly about how to work together. And so if you're ever curious about these sorts of research questions you might have and what exists, there are typically organizations out there or other initiatives that are seeking to not claim their own space, but open this up to your ideas as well, and think creatively about what data proxies they might have in mind, what might exist. And so that's really the sort of characteristic of the community. So I love that I've heard questions from folks that probably don't use GIS actively. And so this is wonderful that this session has started to open that up to others. Yeah. And maybe that's where we should end for today, since we're coming up on the hour. But I really, on behalf of everyone here, Cheryl and Jami, thank you so much for sharing your work and your experience. I think you've given folks a lot of new ideas. I know you've given me some ideas. Cheryl is always someone who has come to my classes and spoken to students. And I think there's a lot of opportunity to make use of the data that these institutes provide and make more easily accessible. And they're also just great resources for thinking of new project ideas. So thank you both for taking the time. It's great that it's time during GIS week. I forgot about that, actually. So it's always wonderful. And thank you, Brian, for co-hosting today. And thanks, Christine and Amy, for setting this up.
Thank you all so much. This was fantastic.
Yeah, thank you for having me.
Everybody, have a good weekend.